This is the third session regarding parasympathetic nervous system by Professor Dr. Sumaya مقبل. Session about cholinergic antagonists. As we know that there are muscarinic and nicotinic receptors. So if we want to block muscarinic receptors, we use muscarinic antagonists. And if we want to block nicotinic receptors, we use nicotinic antagonist. Nicotine receptors, as you know, two main types. One that present in ganglia and CNS. This is blocked by ganglion blocking agents. And in NN receptors. And the other type is NM receptors that present in the motor end plates. If we want to block this type of receptors in the neuromuscular junction, we use neuromuscular blocking agents. We start by muscarinic antagonist or blockers. Actions and chemical structure. They either tertiary amine, alkaloids, or quaternary amine. Plant alkaloids like atropine and scopolamine. Atropine is found in Atropa platona and scopolamine or hyoscine is found in Hyoscyamus niger plant. They are tertiary amine, so can pass blood-brain barrier and well absorbed from the GIT and have CNS action. Synthetic derivatives, either tertiary or quaternary amines, limited CNS penetration. Drugs used mainly as bronchodilators like ipratropium. Drugs mainly used as antispasmodics as hyoscine butyl bromides. Drugs used mainly to decrease its secretion of the stomach in peptic ulcer like drugs mainly for genitourinary system like oxybutynin and tolterodine. Drugs used mainly as mydriatics like homatropine and tropicamides. Mydriatics to dilate the eye pupil. Drugs used mainly to treat Parkinsonism like benzotropine. We start by non-selective antimuscarinic can block all muscarinic receptors. Atropine. Atropine competes with acetylcholine at muscarinic receptors. Competitive antagonist to acetylcholine. Block all muscarinic receptors. Acts both central and peripheral. Actions last from 4 hours, except in the eye it may last 4 days. Mechanism and pharmacological effects of atropine. As we said, muscarinic receptor antagonist, competitive antagonist of acetylcholine at regarding effects on cardiovascular system. Atropine block M2 receptors in SCA node and increase heart rate. No significant effect on the force of contraction because there are no muscarinic receptors or parasympathetic innervations of the ventricles. Blockade of vascular M3 receptors has no significant clinical value. High doses cause toxic vasodilatation in facial flush area, atropine flush, which is not related to antagonistic action. Respiratory, bronchodilation and decreased mucus secretion. GIT, decreased salivation and HCl secretions. Decreased motility and antispasmodic action. Urinary bladder, relaxation of bladder smooth muscles and contraction of sphincter leading to urine retention. Sweat glands, blocking of muscarinic receptors in thermoregulatory sweat glands. This is cholinergic, leading to dry skin and elevation of body temperature, atropine, fever. Children are more sensitive to this effect. Eye, excessive mydriasis due to paralysis of constrictor pupil muscle. Cycloplegia, paralysis of ciliary muscle leading to loss of accommodation to near vision. Increase intraocular pressure due to mydriasis leading to decreased aqueous humor drainage. Atropine actions on the eye. Persistent mydriasis with absence of light reflexes. This is passive mydriasis due to paralysis. Cycloplegia, paralysis of ciliary muscle, loss of accommodation. Dangerous in narrow angle glaucoma. Therapeutic uses, CVS, in cases of bradycardia, atropine given parenterally. Most cases of bradycardia, including reflex bradycardia, caused by vasopressor drugs. Respiratory bronchial asthma, ipratropium quaternary amine, has greater selectivity for bronchial tissue and limited CNS effects. It is given by inhalation to dilate bronchi and reduce secretions in asthma and chronic obstructive pulmonary. Pre-anesthetic medication, pre-anesthetic injection of atropine is used to prevent bronchoconstriction and reduce bronchial secretions caused by excessive vagal stimulation during anesthesia. Protect the heart from excessive vagal tone, which induce bradycardia, occurred during anesthesia. GIT disorders, peptic ulcer by rinzepin has greater selectivity for blocking M1 receptors in the stomach and reduces HCl secretions. However, it is now rarely used because of availability of new and more potent drugs like PPIs. Diarrhea, the classic combination of atropine with diphenoxylate, congener of mibridine, is available under many names like Lomotil. Decreases hypermotility and secretions, abnormal colic, example hyoscine butyl bromide or Buscopan. Fundoscopic examination, muscarinic antagonists are used as eye drops like cyclopentolate and tropicamide to produce mydriatic encycloplegia and facilitate retinal examination. However, phenylephrine alpha agonist is preferred for simple fundus examination due to short duration of action. Motion sickness. It is a very common disturbance of the inner ear that is caused by repeated motion, such as from the movement of a car or ship. Bizarre head movement affects the organs of balance and equilibrium, vestibulocerebellar apparatus, causing nausea and vomiting. Overactivity of muscarinic receptors is suspected to play an important role. Other uses of atropine and atropine substitute, organophosphate poisoning. Atropine is the standard. What are the adverse effects of atropine? Number 1, blurred vision due to mydriasis and cycloplegia. May rise in intraocular pressure and the precipitation of glaucoma in susceptible. Dryness of all body secretions, dry mouth, dry skin, dry eyes, and so on. Urine retention, especially in patients with senile enlarged prostate. Tachycardia. In children, atropine favor due to blockade of thermoregulatory sweating, resulting in hyperthermia and flushing. Children are more sensitive. What are the contraindications of atropine? Narrow angle glaucoma, obstructive disease of GIT, pyloric stenosis, paralytic ileus, sinal atony of the atrium. Urine retention due to senile enlarged prostate. It should be used with caution